Now to the new trio of digits meant to tackle the nation's mental health crisis. 988 is a suicide and crisis lifeline now in its second year. Intended to be easier to remember, it still has a lot of hurdles to overcome, especially when it comes to awareness.
In fact, a recent Pew survey found just 13% of people are familiar with 988, but over a quarter of them either don't know or aren't sure when to use it. What's worse, the holidays can make it more difficult to manage mental health.
Jennifer Hoff is here with us now to how people can connect with services they need. Jennifer?
Julie, not only can you call and text 988, it recently rolled out those features in Spanish, and it's trying to route them to call centers in the same area that the user is in. But at the same time, experts worry that its success is still an uphill battle.
Across the country, suicide rates continue to climb so much that doctors like Dan Reidenberg say new data reveals record numbers last year.
The numbers aren't good. Here in Minnesota, the numbers are up as well.
A leader in suicide prevention for decades, Reidenberg also sounded the alarm about the new mental health crisis lifeline, saying 988 is still building awareness and funding today.
The real issue is that this is around people in a mental health crisis or people that are suicidal, and we don't have that long to wait.
About 5 million people have used 988 in the 16 months since it launched, but a new study found most people in serious distress wouldn't use it again.
We have many populations that are afraid to call 988 because they think they're going to be put into a hospital or they're going to go to jail or the police are going to come. We need to change some of the language around what 988 is and what people can expect when they contact that number.
Congress also invested $1 billion in 988, and some states, like Minnesota, have secured local funding, but Reidenberg worries that won't last.
How long will Congress allow this to continue when everybody is looking at scarce resources? And we have to weigh out, is that investment worth the return that we're getting?
To maintain your mental health, Reidenberg says, remember, take a break, get perspective, and connect with others, not just during the holidays.
If we could do that throughout the rest of the year, we'd see suicide rates drop.
And to that point, he also says that suicide rates are actually the lowest this time of year, in part because we are making so many connections with people more often, say at some of those family gatherings. The highest is actually in the spring and the fall, when stress around, say, starting and finishing school in particular is much greater. Besides 988, there are other local resources that we have posted in this story at KARE11.com if you or somebody you know needs help.